Okay, so we'll be starting with today's session. So before moving on with the session, just a brief introduction to you all. I am your PMRF TA. My name is Sharmishta Majumdar and I'm a PhD scholar at IIT Jodhpur. So I'll be taking the problem solving sessions for you people for the course Maternal Infant Young Child Nutrition, which is being taken by Professor Rupal Dalal from IIT Bombay. So, before going on to the questions for the session, I would like to again remind you people that in case you have any problems or any queries regarding the content of the course or any general queries regarding the questions or exams, you can always put them up in the portal. So, whenever you go to the Swayam portal, when you go to the course, there is a tab where it is written Ask Your Question. So, in case of any queries, you can put your questions there, and be it Professor Rupal Dalal or be any of the TAs. So, we will be answering to your questions. So, in case of any queries, you can always put your questions there. Okay. So, for today's problem solving session, so I'll be covering the matter from the week 3, which has already been shared on the website as the study material. So I am assuming most of you have already gone through the videos that have been posted for week 3, and yeah. So for week 3, as we can see that the videos have taken you through the importance of the micronutrients, namely calcium, magnesium, potassium, which are very important nutrients responsible for both the functionality and growth of an individual. So you have gone through all these importance of these specific micronutrients, and you have seen the specific recipes that Professor Dalal has beautifully explained about the recipes, how these can be implemented in the clinics or maybe in the houses by even mothers to improve their child's health. So, of course, these problem solving sessions are very much targeted towards your examinations and assignments. So, I'll not be talking much more on the recipe side, but of course, we'll be discussing on some of the basic concepts from which you can get questions in your examinations. So, going to the rest of the content that has been already shared for week 3, we have junk food and reasons for consumption of junk food, the importance of insulin, introduction to insulin resistance and the effects of high levels of insulin, and then the introduction to macronutrients and the nutrient count of day to day foods. So now I'll be straightly going to the question pattern and how we can get the basic knowledge of certain concepts and how we can make an estimate of the different kinds of questions that we can get in our exams. So, for the first question, as we can see, what is a condition caused due to vitamin D deficiency in adults in which bones become soft and weak? So, can anybody volunteer and tell me the answer?
Osteomalacia.
Osteomalacia, correct. So here osteomalacia is the correct answer, but before going into the details of osteomalacia, I would also like to touch upon the other options. So all of us, we are pretty much yeah. So all of us, we are pretty much informed about anemia, how anemia can be of different types based on the nutritional deficiencies. So either it can be iron deficient anemia, or it can be because of deficiency of vitamin B12. So of course, whenever you're studying for your examination, you also need to keep in mind these different deficiencies and because of which these deficiencies are being created, and what could be the clinical manifestations that are more important that a child or anybody, as a matter of fact any individual, can report to you, and these clinical manifestations are hence very important for us. So second, osteomalacia, definitely it is a vitamin D deficient condition in adults. C, scurvy. Scurvy, as we all know, it is a vitamin C deficiency which can lead to bleeding gums and a lot of oral manifestations. Beriberi, so it is a vitamin B1 deficiency, which is caused by the deficiency of thiamine, definitely, and it can have nerve and muscle manifestations. So, now coming to the most important thing in this slide, I would like to mention about rickets. So, as we have already said, that osteomalacia is in adults. So, this vitamin D deficiency, when happens in children, it is called rickets. So, rickets is a major thing that we need to be informed about. So, if we look at the manifestations of ricket, so this is mainly found in children. So 1 to 5 years of age, these children are majorly affected by rickets. So how do you understand if a child comes to you, and how do you say that this child has rickets? So this deficiency is characteristically, it shows some of the features. So ricket, as we all know, is a skeletal deformity. So obviously you are expected to see a change in the shape of the spine. And apart from that, you can also see sunken ribs in that child, and you can see a protruded forehead, along with, say, wide wrists. And the most important thing which should come to your clinical eyes is the bow shaped bent legs. So, these are the very characteristic features of a child who has been affected by the vitamin D deficiency. So, of course, whenever you're studying for your examination, so these all matters need to be kept in mind. What are the clinical conditions, what are the vitamin deficiencies, and how we can obviously identify that would be definitely helpful in our day to day life as well. So coming to the next question, puffiness in hands, feet, and face is a sign of sodium retention. Calcium deficiency during pregnancy causes swelling in hand and feet. So here we have two statements, and we have the options. Option A, which says A is true and B is false. B says B is true but A is false. C says both A and B and false, and D says both A and B and true. So I would like to ask anybody of you who would like to give an answer to this. Anybody? Yes.
Both A and B are true.
Right. A and B and true. So we know puffiness in hands, feet, and sign is a sign of sodium retention. So obviously, people among you who have been in the clinical area, you know that edema is a very specific sign of sodium retention. So that means a puffiness in hand and feet, right? So now what happens when we are telling about calcium deficiency? So calcium deficiency is a condition where calcium is unable to, whatever, when say for suppose a child or an individual has more salt intake in his diet. So when this salt is more in his diet, this calcium helps to wash out this extra sodium as well. But say for suppose we do not have that calcium in the body, say like the calcium deficiency during pregnancy. So if our micronutrient is not present in the body only, so of course it is not being able to wash out that extra sodium which is there in the body. So obviously that extra sodium is creating these puffiness, or in simple words, edema in the body. So of course both A and B are true. So going to so it is known that calcium and sodium metabolism are linked, and that higher sodium intakes may increase calcium excretion. So now going to the third question. Say a woman who sits indoors near a closed window would still be deficient in vitamin D. Why? So anybody would come up with the answer? Yes, please go ahead. Please unmute yourself.
It is a C. Glass windows are blocking the UV light.
Yes, absolutely. So we all know that the major source of our vitamin D, it comes from the sunlight, right? And the specific type of light that we are getting is the ultraviolet B kind of rays, which are creating or which are forming the vitamin D in our body. So of course, even if a person is sitting in front of a window for the entire day, still the person won't get the optimal levels of vitamin D in his or her body, because of course the glass windows, they are blocking these rays. So these are very easy, um, these are very easy questions, and of course you all know the answers. But again, just to emphasize on the fact that these are some very basic situations which we need to keep in mind for our day to day lives. So next, yeah. So as the image shows, from the sunlight, obviously the UVB is causing the formation of the vitamin D in our body. So next, a person drinks 10 cups of coffee each day. So he is most likely to suffer from which kind of deficiency? We, yeah, anybody would like to answer? I want you people to answer so that we can discuss more on this, because these are all very
Okay,
easy.
Vicky.
Sorry? Yes, Mrs. Patil?
And answer B, calcium deficiency.
Yes, of course, calcium deficiency. So we know the answers to these questions, but of course, all of us, we keep on doing things like these in our day to day lives. Say, for suppose, whenever we are stressed, we drink a lot of tea or coffee. So, of course, we know that tea and coffee, it contains caffeine, and this caffeine, it inhibits the absorption of calcium properly. So hence, in spite of knowing, if we in spite of knowing this, if we keep on drinking coffee, 10 cups of coffee and 10 cups of tea each day, so of course we know that we are messing up our with our calcium absorption in the body. So we are very likely to suffer more with calcium deficiency. So apart from I think there are some healthcare professionals here, there are some people from nutritional background here. So apart from telling this to our patients also, it is very pertinent and it is very significant that we ourselves also keep this in our mind. So yes, so caffeine, it messes up, it inhibits the calcium absorption in our body, and hence this might lead to a very important deficiency in our body, which is the calcium deficiency. And we all know that many of us, we already take calcium supplements, but the best way to supplement calcium would be from the food. So for the next question, vitamin D dietary intake was increased for a patient, but the active vitamin D levels were still less. So, why do you think it is still less even after externally supplementing the required vitamin D requirement? Yes, anybody?
Is a magnesium deficiency which inhibits vitamin D absorption.
Yes. So, as we all know, as we have just discussed, that uh, vitamin D, the major source of vitamin D is from sunlight or the UVB rays. So now this sunlight, it forms the vitamin D in our body, but then obviously the body cannot utilize the vitamin D in its formed state, because it is still in an inactive state. So to activate that vitamin D, what we need is a cofactor, or say some other micronutrient, which in this case is magnesium. So as we can see in the schematic, so from the sunlight we get the vitamin D3, and from our dietary sources we get vitamin D3 as well as D2. So these need to be activated with the help of magnesium, which is acting as a cofactor here, and then it can be converted it can be converted to calcidiol, which then is again converted to calcitriol. So in absence of magnesium levels, sorry, so in absence of proper magnesium levels, we cannot expect our patient to fare well, even if we are giving them a whole lot of vitamin D supplements. So it might many a times occur that the patient is taking a lot of vitamin D supplements. You are giving them oral supplements, you are giving them injections, and you're asking them to take in a lot of sunlight. The patient is sunbasking the entire day outside, but still since we haven't looked upon to the other scenarios as to what are the deficiencies the patient might have, so the vitamin D situation in the patient's health is not improving. So of course magnesium deficiency here is a very integral factor as to why the vitamin D should be converted from the inactive state to the active state. And of course in magnesium deficiency cases, so this is the problem why the patient won't be getting the required amount of vitamin D. So coming to the next question, which of these fat soluble vitamins help in absorption of phosphorus and magnesium? So again, I am 100% sure all of you know the answer. So I would just request somebody to tell me the answer.
C.
Yes. So as we know, we have two types of vitamins, the water soluble vitamins and the fat soluble vitamins, right? So the fat soluble vitamins are A, D, E, K. Of course, we have the synonyms for them: the tocopherol, which is the vitamin E, the retinol, vitamin A, cholecalciferol, vitamin D, and phylloquinone, which is the vitamin K. So as we all know, phosphorus and magnesium, these are very important type 2 micronutrients. So these are basically required for the growth of the child or any individual. So along with these phosphorus and along with the absorption of phosphorus and magnesium, vitamin D is also responsible for the absorption of a very major type 1 micronutrient. Can anybody tell me what is that?
It's C.
No, I'm not asking the answer. I'm asking, along with phosphorus and magnesium, vitamin D also helps in the absorption of something else. What is that? Which is a very major type 1 micronutrient. We have studied micronutrient type 1 and type 2 in the last session. So there is one more type 1 micronutrient which is very important for our body, and we have been studying about it, and vitamin D helps in absorption of that as well. Yes, Mr. Vasireddy, would you like to answer? I think
Is folate?
Calcium.
yes, it's calcium.
Calcium.
Absolutely correct. It's calcium. So calcium is a very, very, very important type 1 nutrient which is helping in the functionality or in the functional aspects of the body. And of course, these micronutrients, type 2 micronutrients, they are helping in the growth. So these we have discussed in our last session. And vitamin D is one of the prime factor which is helping in the absorption of phosphorus, magnesium, and calcium. So of course, these are all interlinked. So you cannot say that any deficiency is isolated. So whenever a child or an individual or any adult comes, you cannot say that, okay, this person has only this kind of deficiency, so I will only see this and this is how I will treat that person. But we need to have a very wide spectrum, or we have to have a very wide picture of the entire situation, where a person with vitamin D deficiency, of course, will be having phosphorus, magnesium, and calcium deficiency, most likely. So it is very important for us to know which kind of macronutrients and which kind of micronutrients are interlinked and interdependent on each other. So again, just to stress on the fact, the questions are easy, the answers are easy, but these concepts will be helping us in the long run. So we'll go to the next question. Headache is not a sign of magnesium deficiency. Magnesium intake helps in improvement in insomnia cases. So anybody would like to give me the answer? Anybody would like to volunteer? Yes?
Is it B?
Yes?
B.
B. Correct. So B says B is true but A is false. So let us go to statement A. Statement A says headache is not a sign of magnesium deficiency. Okay, so if we say that A is false, that means headache is a sign of magnesium deficiency. Yes, definitely headache is one of the most major sign of magnesium deficiency, and it comprises all kinds of headache, say migraine, cluster headache, all kinds of headache. Second is magnesium intake helps in improvement in insomnia cases. So, of course, along with headache, be it your general well being, your general health, and apart from that, magnesium it helps a person to sleep properly. So all of these insomnia and sleep pattern disturbances cases, there might be chances that the patient is suffering from severe magnesium deficiency. So, apart from the major causes that usually comes to our mind when we see a clinical manifestation of a headache, we should also consider these kinds of micronutrients and the vitamin deficiencies, which are also very major causes of these manifestations uh, in child or in adults. Okay, so going to the next question. 30 gram of beans have around 64 milligram of magnesium. So the answer is true. And the reason why I have this question in the problem solving session is because many a times we are not really friendly with numbers. We don't like studying numbers. But in this course, I think it is very essential for us to know how much of a nutrient has how much of how much of a food entity has how much of a nutrient. So that is very essential in this course, because ultimately there are a lot of people from the nutrition background. Yeah. So there are a lot of people who are from the nutrition background, and when they cater to their patients, so these things will obviously come in handy. So also another reason for having this question is, as I have mentioned about magnesium, but obviously when you'll be studying about the other micronutrients, those are very important, say calcium, potassium. So you should also be having an idea as to exactly how much of what food material has what nutrients. So hence this question is just a familiarization to you people, so that you know how you should go forward with your study material for the exam purpose. Okay, so next we have, what is a major source of potassium? Anybody would like to volunteer?
Bananas.
Okay, so here, um, all of us, yes, yes, anybody else?
Yeah,
Both. A and B.
yeah, and B.
A and B.
A and B. Okay, so um, all of us, we know that bananas are a major source of potassium. But contrary to that fact, apart from bananas, if we say that what is the major source of potassium, green leafy vegetables and sprouts have been found to have the most amount of potassium. So in spite of having this idea from a long time that bananas give us the most amount of potassium, we should know this. So, contrary to our beliefs, the answer to this question is both B and C, that is, green leafy vegetables and sprouts. Okay, so we'll come to the next question. Magnesium deficiency will also cause. So we have our options: choline deficiency, vitamin C deficiency, vitamin D deficiency, and potassium deficiency. So, what is the answer, do you people think? What could be the answer? Yes, Mrs. Patel? Yes, would you like to answer?
A.
A is not the answer.
Potassium deficiency.
Yes, potassium deficiency. So, would you also like to tell why do you think it is potassium deficiency?
Associated with potassium deficiency, magnesium deficiency is always associated with hypokalemia also. So it it aggravates that both the things are required for each other to absorb.
Yes, of course. So, if we go a little bit into the mechanism part of it, just to be clear on why magnesium deficiency will also lead to potassium deficiency, magnesium is the most important cofactor which is required for potassium absorption in the kidney. So, magnesium will be helping in the renal absorption of potassium and also the overall maintenance of potassium in the cells. So, this entire circle is being mediated by magnesium. So, yes, magnesium deficiency will also cause potassium deficiency. So next we move on to what is pica. So anybody would like to volunteer?
Option B.
Yes.
Intake of inedible substance like clay
Yes.
or soil.
Yes, absolutely. So intake of inedible substance like clay or soil. So this condition is a very unique condition that has been seen in various children where they kind of start eating inedible substances, say like clay and soil, dirt, even nails. So sometimes it has been seen that this pica condition has been directly corroborated or connected to deficiency of iron, calcium, and zinc. And this pica can also lead to magnesium deficiency. So, of course, whenever there is a patient of pica or whenever you come across a child who might be having this tendency or this condition, so of course these things are also be kept in mind that this child might be suffering from these kind of deficiencies, and hence it is very important to supplement these kinds of nutritious things through the diet of that child. So hence recognition of that condition of the child is very important, and why these might lead to these conditions are also very important to be taken into notice. So yeah, so here we have a very cute child who's eating dirt. Next, sudden loss of potassium level. Sudden loss of potassium, it leads to, anybody would like to volunteer? Okay. So a sudden loss of potassium leads to an increase in blood sugar level. So why do we say the potassium might lead to an increase in blood sugar level is because yeah, so whenever there is a reduction in the so whenever there is a reduction in the levels of potassium, sorry, so this directly impacts the insulin. So this also inhibits the release of insulin. So as we know, insulin is directly related to the blood sugar level. And hence, if our potassium is inhibiting our insulin level, so this insulin will definitely again impact our blood sugar levels. So hence, the inhibition of insulin is impacting the is okay. So hence the inhibition of insulin is leading to the increase in the blood sugar levels. So again, if we need to know more about the potassium's effect on blood sugar level, so it also sensitizes our cells to thyroid hormone, so they can receive adequate amounts, allowing the cells to remain sensitive to insulin. So this is one mechanism how it affects the overall blood sugar balance. Second, as we have said, that the potassium, it directly inhibits the insulin release, and hence it increases the blood sugar level. Again, the potassium is directly involved in the conversion of glucose to glycogen that can be stored in liver for future energy, and hence it can also reduce the risks of blood sugar uh, reductions. So that is how potassium, a micronutrient, is also so much important in the blood sugar balance. Okay, so next, yeah. the recommended intake of potassium for a 4 to 6 year old children is, okay. Again, the reason for having this question for you all is that we should always know these recommended intakes of all these micronutrients. So, of course, the recommended intakes of these important micronutrients, they are very much age dependent. Say for suppose whatever intake is required for a child, for an infant would not be the same for an adult. So, say the requirement of potassium for a 1 to 3 year old child would be definitely different from what a 4 to 6 year old child will be requiring and what an adult would be requiring. Also, it is different for what a woman would be requiring and a man would be requiring. So, if we think from the point of view of your examinations, you also have to keep in mind all these recommended intakes for the different age groups as also for both the genders. So as we go through the different options here, we have 1100 milligram per day. So this I wouldn't ask you the answer. We will just go through it. So just make sure that you go through these data which are given in the slides so that it is easier for you to answer these kinds of numerical, kinds of questions in the answer in the exam. So 1100 mg per day, it is the recommended intake of potassium for children from 1 to 3 years of age. Yes, Mr. Odhikari, would you like to say something?
Yeah.
Yes.
Actually, the answer is D.
Yes, the answer is D.
4
Yes,
to 6 years old children.
yes, yes, definitely, you're correct. Yes, thank you. So, as Mr. Odhikari has very rightly said, that for the 4 to 6 year old children segment, the recommended intake for potassium is around 1550 milligram per day. And for 1 to 3 year old children, it is 1100 milligram per day. And if we consider options B and C, of course, we have 3750 milligram per day, which is the recommended intake for men, and 3220 milligram per day, which is the recommended intake of potassium for women. So,
Women.
yes. So, these are the things that you people need to keep in mind whenever you are just going through your examination material, so that you go through all these specific micronutrients and what are the recommended intakes in case of all age groups and both the sexes. Yeah. So, directly going on to the next question, um, insulin's response to different food item varies. So, which foods have the maximal stimulating effect on insulin?
Carbohydrate rich foods.
Yes, absolutely.
A.
Yes, anybody else is saying anything?
No, same. It's
Yeah.
A, carbohydrate rich food.
Yes, absolutely. So all of us, we know that carbohydrates, these are basically very rich sugar foods. So hence, whenever we are considering the situation related to insulin, so carbohydrate rich foods obviously will be having the maximal stimulating effect on insulin. So the people from the nutritional background, hence it is very imperative for you people to understand how much and what kind of a diet you'll be giving to people with say type 2 diabetes. So and how the balance of their diet will be maintained based on the different macronutrients, which are the carbohydrates, proteins and fats. So as we can easily say that carbohydrate rich food, they have the maximal stimulating effect on insulin. So after that, protein rich food, they have comparatively lesser stimulating effect on insulin. And fat rich foods, they are the group of macronutrients who have the least stimulating effect on insulin. So, of course, there is a very significant need why we need to tell people that you should be taking good fats. It is not that you should stop eating fats, you should stop eating ghee or butter or any kind of fat, but it is the specific kind of fats that you should be taking or you should be feeding to your child, and how much of that fat you should be feeding is also very important. Yes. So fat, definitely good fat. So that good fat rich foods, these have the least stimulating effect on insulin. Okay. So next we'll go to the question, which of the following are complementary in nature? Yeah. So as we all know, pancreas is a specialized organ of our body which secretes both hormones and enzymes. Excuse me. Yes. So for enzymes, we have a couple of enzymes which are very important for the entire metabolism that are being secreted from pancreas. So here we have the glucagon, we have insulin, we have somatostatin, and we have pancreatic polypeptide. So of course, these names are very known to us, and when we are talking about the enzymes which are being secreted from pancreas, we have amylase, which would obviously be acting on carbohydrates, lipase, which would be acting on fats, and proteases, which would be acting on proteins. So that we can easily make out from their terminologies. Now the question says, which of the following are complementary in nature? I know all of you already know the answer, so I will just directly go with the explanation. So, whenever we are considering these hormones that are being secreted from pancreas, so we have very three important hormones that we talk about. That is glucagon, which is being secreted from the alpha cells of the from the pancreas, insulin from the beta islet cells of the pancreas, and somatostatin from the delta. And among these, the glucagon and the insulin, they are of more importance for us, because what we are talking about is the complementary function that it serves in the body related to the carbohydrate metabolism, or in general the blood sugar levels in the body. So whenever there is as we all know, whenever there is say um, greater uh, yeah okay, say for suppose, whenever a child or whenever an individual is already taking a very carbohydrate rich or a very sugar rich diet, so that needs to be taken care, or that is taken care by the insulin, where it reduces it breaks those carbohydrates into its simpler forms, and hence it helps it to get stored for later availability of energy. That is what we all know. It gets stored in the liver as glycogen, and then it can be. Yes, somebody raised a hand. Okay. So that is how insulin is helping to keep the sugar levels, or the high sugar diet in check, where it is helping to store that for the further requirement of energy when there is less amount of sugar in our diet. Again, glucagon. So what happens if we have less sugar in our diet, or when we are in requirement of that sugar but we don't have it available for our body? So glucagon helps to create that required amount of energy, or it helps in the gluconeogenesis, that it is converting glucagon into what our body is requiring. So of course, this insulin and glucagon, they are operating in a balancing method, and hence these are complementary in nature. So we should always be informed about what glucagon and what insulin is doing, and how our glucose is being converted to a different form and stored in the body, and then being utilized when our body is deficient in glucose, and then how glucagon is again converting another form into glucose, and then our body is utilizing it. So, of course, the answer to this question, which of the following are complementary in nature, is glucagon and insulin. And it is very important for us to know how it is impacting our entire blood sugar cycle, because that is very important whenever the diabetes situation comes into picture. So, for the next question, what can result to heart disease? So, number one, consumption of nuts and seeds, consumption of non-vegetarian foods, consumption of vegetables, consumption of foods rich in refined sugars and vegetable oils. So,
It's
as we,
the
yes, sorry.
consumption of food rich in refined sugar and vegetable oil.
Yes, absolutely. So, as we all know, any ultra processed food or any refined food is very bad for our health. So, here, whenever we are talking about cardiovascular diseases, so the fat, uh, mm, the the situation of the fat also comes into our mind. So, what are we eating, and what is the processed level of it? So, say for suppose, if we consider the first option, the consumption of nuts and seeds, we have omega 3 in the nuts and seeds, which are good fats. Consumption of non vegetarian foods, obviously, they are giving us those proteins that are definitely required for our body. Consumption of vegetables, of course, vegetable is giving us all the micronutrients, and along with that, the different roughage that is definitely required for our body to get the adequate amount of nutrients required for both the functionality of our metabolic functions and growth of an individual. But of course, whenever we come to refined sugars and vegetable oils, so vegetable oils, they can be hydrogenated, like oils which have been solidified for ultra processing of the food. So these things obviously should be cut out from our diet, that can definitely result in cardiovascular diseases. So this is not something new, all of us we know, but definitely this needs to be completely implemented in our day to day lifestyle also, where we also know that these are something that we shouldn't be delving ourselves into. Say for suppose junk food, we feel good when we eat those junk food. The dopamine release is so much that it gives us a feel good moment, and we keep on gorging on those junk food. But definitely, this is not just a question, but also a signal to us that we also should stop doing that, and start uh, I mean the theory that we already know, we should also start practically following that. So I will next go to the question. So, a person was recently diagnosed with type 2 diabetes, and his fasting blood sugar levels were usually above 170 mg per dl. So, why do you think this is happening? So, before that, I would like anybody to just share with us what do you think is the specific difference between type 1 diabetes and type 2 diabetes? Anybody?
Type 1 diabetes is a juvenile onset diabetes, and type 2 is a adult onset type of diabetes. In first, the child, it occurs to the small children, and there is no insulin production in that diabetes.
Right.
So they are totally dependent on insulin for
Insulin.
their glucose metabolism. And second type of diabetes, that is type 2, it occurs after the 45 years of
45
age, or
years of age.
and it is just because the insulin secretion is very limited in quantity, or its rate of release is very slow, so that the glucose metabolism occurs in the very slow rate.
Slow rate.
And they have to take some sugar insulin producing drugs, or they have to take insulin. This is the
Yes.
basic difference between
Yes.
type 1 and type 2.
Absolutely. Yes. So thank you for answering. So type she has very correctly said the major differences between type 1 and type 2. So if we consider our question, so type 1, it practically there is little or no insulin at all. And in type 2, say for suppose there is insulin, but it is not acting properly, or very less insulin is being secreted, or there is adequate insulin but it is not being able to do its job of keeping the glucose level in check. So if we consider this question, we can already see that the blood sugar levels, they are above 170 mg per dl. So that means it is not even borderline diabetic or pre-diabetic, it is already diabetic. So it is a case of type 2 diabetes mellitus. So where sorry, so this is a case of type 2 diabetes mellitus, so where there is already a production of adequate insulin, but this insulin is definitely not being able to keep that sugar levels in check, and because of which we can see that there has been a very high raise there has been a very high increase in the levels of sugar in the blood sugar levels. So of course, for the answer for this question is, the body is producing adequate insulin, but it is not being able to do its job, hence the blood sugar levels are constantly high. So for the next question, what is the normal fasting insulin level in an healthy individual? So as we all know, for diabetes, of course, we keep on figuring out the random blood glucose level, the fasting blood glucose level, the postprandial blood glucose level. But of course, we should also be very much informed about the insulin level. So when we are considering the normal fasting insulin level in an healthy individual, so what is the usual range, do you think?
2 to 5 milli
Yes, yes,
international unit per ml.
absolutely. That is the correct answer. So 2 to 5 milli international unit per ml is the normal fasting insulin level in a healthy individual. And of course, whenever we are having, or whenever we are facing levels which are lesser or greater than that, so accordingly, the diet or the medication of that patient needs to be catered. So we'll go to the next question. Protein digestion starts from. So anybody would like to answer?
From mouth.
Okay. So here I would just like to tell you, whenever we are considering the three macronutrients, carbohydrate, protein and fat, so they have a very unique pathway of their absorption. So here let us first talk about carbohydrate. So when
Sorry, it is the stomach. Sorry.
Yes, yes. So let us talk about carbohydrate. So as we all know, whenever we eat carbohydrate, the absorption of that carbohydrate immediately starts from our oral cavity because of the action of salivary amylase. And that salivary amylase, it obviously breaks down the carbohydrates into the simple sugars or the disaccharides. So then it goes through the it goes through the subsequent stages of absorption in stomach and intestine, and then leads to the entire absorption cycle of the carbohydrate. Now in case of protein, as Mrs. Patel has very rightly said, the protein digestion, it starts from the stomach. So we have HCl and pepsinogen in our stomach, so which is directly acting on the proteins to break them into our amino acids. And then that protein is directly going into the intestine, and the subsequent absorption follows. So it is to be kept in mind that the carbohydrate, it immediately starts from the mouth, the protein digestion, it starts from the stomach, and the fat digestion, it happens initially in the intestine, where the fat, they are broken down into their fatty acids and glycerol. So from again repeating from the exam point of view, it is important for you to just keep in mind these very basic things. I'm sure all of us, you already know this, but just for your assignments and exam, these little things need to be kept in mind. So next we go to which fats should be eliminated from the diet. So we have just discussed that fats are not all bad, they can also be good fats. So what do you think, which fat should be in our diet and what shouldn't be in our diet? Yes, A.
Trans fats are to be eliminated.
Yes. So trans fats should be definitely eliminated from our diet. Now, why trans fat needs to be eliminated from our diet? So let's go to our options. So first, what is a saturated fat? If we consider the chemical composition of a saturated fat, so it is a saturated, it has got all saturated hydrogen bonds which are completed with single bonds. So hence you will see these saturated fats, they are solid at room temperature. They can turn solid at room temperature. Say for example, coconut oil. So coconut oil is a saturated fat. If we go on to the unsaturated fats, so these might have chemically, these have double bonds with hydrogen and carbon. So as we know that fats are basically long chains and short chains of hydrocarbons. So these unsaturated fats, they are again of two types, monounsaturated fats and polyunsaturated fats. So these are usually liquid at room temperature. Say example, olive oil. So whenever we are considering unsaturated fats and saturated fats, the unsaturated fats are definitely at a superior level that is required in our diet. So when we say um, we all must have seen that this food contains this MUFA and this PUFA. So of course these monounsaturated fatty acids and these polyunsaturated fatty acids, they are very important in our diet. And apart from that, omega 3 is obviously very important, as we all know. So these three are absolutely indispensable from our diet, and they need to be supplied, or they need to be supplemented, they need to be taken into our diet through the proper food for both children and adults. So now coming to the trans fats. So these trans fats, these are basically those fats, those liquid oils of fats that have been solidified. They have been hydrogenated and they have been changed. So as I have already mentioned before, so these are used in very ultra processed foods and very refined foods, and hence these trans fats are definitely not required from our diet. So whenever, from the next time we buy a packet of processed food, it is very important for us, or maybe it would be better if we all go at the back of the packet and see that what amount of trans fat is there. So I think that is a very good way to aware ourselves as to what we are eating, even if we are eating ultra processed food. So yes, trans fat should be eliminated from the diet. So this was the last question for today's problem solving session. So before ending this session, I would just like to tell that since all of you are from different backgrounds, and this course is again very unique, and of course there are a lot of things that needs to be um, you know um, learned from the recorded videos that Professor Dalal uploads, and there are a lot of good things that we can learn from the different recipes that are available. So again, just these recipes are of course not important from the point of view of examinations, but obviously that is the reason why all of us, we are in this course out of interest. So from the these problem solving sessions are, yeah. So these problem solving sessions are specifically to help you out with some questions that can be, useful for you for your further assignments and examination. But of course, as I have said in the starting of the session as well, if you have some queries or if you have some questions, you can always put those in the Ask a Question tab, which is there in the Swayam, the course portal. So, and apart from that, I would also like you people to suggest that since there are different kinds of people in the classroom, so I would really like you people to suggest as to what would be a proper way that I could take these problem solving sessions. What I mean, if any suggestions that you people have, I would be very happy to welcome those suggestions. Though these are like very basic questions and very easy answers, but I hope I am able to be of some help to you all. So thank you for joining. So we'll wrap up the class for now. Thank you.
Thank you very much,
Thank
ma'am.
you.
Thank you.
Thank you so much, ma'am.